Hi guys, Tom Morrison here, and today we want to give you an awesome drill that you can use if you are suffering with IT band syndrome or knee pain on the outside or hip pain on the outside as well. So a lot of this can come from overuse and your hips not moving properly. So we want to go straight for the cause and ask you, are you rotating your hip? Okay, so here's what the drill looks like. First of all, Jenny's going to hold on to a post and we're going to do it really strict first of all. So she's going to lift her knee up as high as she can, and then without changing anything in her body, she's going to then bring the knee out like this, so look like I'm a Jedi. Then she's going to try and rotate her hip inwards without dropping the knee. She pushes her leg back a little bit without arching her back, and then brings the knee back down, and then she goes back up as high as she can, and then rotates it back in, and then brings it back around to the front. So that's what the drill is going to look like. If you never do this, you need to start doing this because your hips are meant to rotate, and if you never do that, then you basically turn yourself into a fridge and you start waddling whenever you're walking. So it's very important you can actually rotate the hips. So how we can play with this drill, you will not look like how Jenny looks, because Jenny has a really high level of flexibility. It's a goal to get there if you want to get there, but most standard people will be just probably, we would have that about there and then out. And what most people will find is when they try to internally rotate here, the knee will start to want to drop, or it'll feel really like stiff here at the top. Okay, so what you can start to do from there would be to break the positions down. Okay, so Jenny can rotate inwards and say her knee was to drop. What she can do there is use her torso to help. She can lean her entire body across, which will help her to get her knee up higher. Then she can bring her body back up again, and that's how she can start to create more range. That way she's able to feel tension there and hold the position and teach her body how to actually move there. Then she can start to try and push back from there, squeeze her glute, and then bring it back down. And then see on the way back up, if she does the drill in reverse again, can she get back to that same range again? Now this could take a few days, could take a few weeks, could take a few months, but you can progressively work on this drill and get better at it every time you do it. Okay, so another variation, if we bring the knee up again and then out, most people when they do that at first, they'll probably open up their hip fully here. What you can start to do there again is bring your hip back through again, and you'll really start to feel the glute a lot more intense whenever you do that. So break down each position, okay? And try and create tension. Then try and go for the full thing and give yourself a little bit of assistance. So what you don't want to see is you doing things without knowing about them. So if Jenny was to round her back when she lifted her leg and then open out, and her hip was to open up, and then her torso was to go as she was rotating and all that there stuff, if she's allowing herself to do that to give herself a bit of extra room to try and make the drill a bit better, that's cool. But if she doesn't know she's doing it, then that's not great. So the way you can be really strict about it is imagine that everything else here is in a full-on plank position. Nothing can change here, and then you'll actually see what true hip range of motion she has. So if we see any movement from the torso, not allowed. So we're trying to break this down now. We're trying to be really strict with it. So work on this drill every day, say 5 to 10 reps each side, and over time you'll start to notice that your hips feel a lot better, they move a lot better, and you stop getting these random aches and pains. Your knees will feel better, your glutes will feel better, and everything will just go a lot better for you.